Today's Pet Advice segment is sponsored by University Veterinary Care Center. We welcome Dr. Travis Gratton with University Veterinary Care Center. Dr. Gratton, good morning.
Good morning. Cold one today.
It sure is. Definitely a change from yesterday for sure. February is National Heart Month, and we talked last time about dogs. So today, let's talk about our feline friends. Do cats develop heart problems?
Yeah, we definitely see some heart problems in cats. Luckily, not near as frequently as we do with dogs. Certainly to follow up on Dr. Guernsey's topic from last week on heartworm disease, we do occasionally see a cat with heartworms, although it's much less frequent than dogs. They're not the natural host, so it doesn't survive in them quite as effectively. But there's some other things that we see.
Well, what are the most common heart problems in cats?
Well, there's really kind of two big categories that account for probably 90 to 95%, and most of those actually fall into the category of cardiomyopathy, which means disease of the heart muscle, and it's generally genetic predispositions to the heart muscle losing its ability to act as a functional pump. And so most of them are what's called hypertrophic cardiomyopathy, where the heart muscle actually thickens. It's almost like the stereotypical muscle-bound bodybuilder. It's so much muscle that it just can't really function. The walls become so thickened that the chambers where the blood is flowing is actually too small, and just doesn't really work well for the cat. The other one, which we see, is related to thyroid disease, and so hyperthyroidism in cats can cause a classic heart disease, and often affects the heart.
Are there signs that we can be watching for in our cats that may signal that they might have some heart problems?
Yeah, certainly. Unfortunately, the most common symptoms are that they can't breathe or they can't walk. So you can get respiratory problems from some congestive type heart failure, kind of similar to dogs, although cats almost refuse to cough, even with severe problems in the lungs. But they do have trouble breathing, difficulty catching their breath, become less active, which my cats are less active all the time. But the other thing is they will form clots in these abnormal chambers of the heart, and when those clots break loose, they can have devastating effects when they flow down through the major vessels, and often they end up causing really painful paralysis of the rear legs because they block blood flow. So.
Well, which cats are at highest risk?
Well, for the cardiomyopathy, it is most common certainly in the long-haired purebreds, the Maine Coons, the Ragdolls, and so they kind of come along with that. There's certainly some that shows up even in your average domestic short hair, just kind of your day-to-day cat that we often have in our lives. The second problem, the hyperthyroid disease, where the thyroid gland develops benign tumors, much more common in the older cat, often in the 8 to 10 and older category. And luckily that one is actually very treatable. If we address the thyroid disease, we can actually often reverse the heart disease.
We'll talk a little bit about how heart disease is diagnosed.
Well, unfortunately, a lot of times it does kind of come up as sudden and severe. Cats tend to just kind of deal with things. They hide their problems. They just, are kind of like, yep, I got this. I'm good. Leave me alone. And then suddenly they're really sick. But sometimes some of the irregular heartbeats or the mismatch between heartbeats and pulses, or the bounding nature of this hypertrophic heart can be picked up on physical exam. The thyroid testing often is either suspicion on other symptoms associated with it. A lot of times it's kind of picked up on routine screenings of these older cats when we do blood work on them.
All right, Dr. Gratton, good advice as always. Thank you for your time this morning.
Thank you so much.
And for more information about University Veterinary Care Center, just head over to universityvetcare.com.